If you're pregnant or you've been pregnant, you are likely familiar with swelling, particularly in your legs, your ankles, your feet, and for me, my fingers. It almost felt like I had arthritis because my hands were so swollen. And, this can be incredibly physically uncomfortable, and it can also drastically change your appearance. So there's lots of reasons why we want to figure out how we can reduce some of that swelling. It's also important to note that it's often the most intense at the end of the day and deeper into the pregnancy. Those last few weeks gestation can be intense with the swelling, especially if you're pregnant during those hotter months. And swelling that, comes on gradually is usually not harmful to you or your baby, but it can be uncomfortable. However, if you have a sudden increase in swelling, this could be a sign of preeclampsia, and this is a condition that needs to be monitored as soon as possible. So call your care provider immediately if you ever experience the following: a sudden increase in swelling in your hands, in your face, or your feet, a really intense headache, problems with your vision, like, blurring or flashing lights in your eyes, severe pain just below your ribs, vomiting with any of these symptoms. And so again, these could all be signs of preeclampsia. So please don't ignore your body when it's giving you a sign that something is off. If in doubt, let your care provider know, even if they just tell you, yep, you're just dealing with, normal symptoms, don't worry about it. It will at least calm your mind, calm your nerves. So if in doubt, let your care provider know. All right, so what can we do? Number one, reduce your sodium intake. Sodium can make your body hold on to extra water, which obviously can enhance that swelling. So try to avoid using, canned processed foods, as they're especially high in sodium. And if you can, try not to put too much extra salt on your food. Instead, you can use, more savory herbs like rosemary, thyme, oregano to flavor your food. All right, you also want to increase your potassium intake. Not getting enough potassium can make the swelling worse, as potassium is really important in helping to balance the amount of fluids that the body holds on to. And your prenatal vitamin should have some extra potassium in there for you, but it's also important to get plenty of potassium through the food that you eat. So some foods that can help to do that are potatoes with the skin on, sweet potatoes also with the skin, bananas, spinach, beans, some fruit juices like prune juice, pomegranate, orange, carrot, and passion fruit, yogurt, beets, salmon, and lentils. And these are all things that are just really good for you in general anyway. So, all right, reducing your caffeine intake. So, while some caffeine during pregnancy is totally fine, drinking way too much of it can intensify the swelling, because coffee is a diuretic, which causes you to pee more, which you might think is good, but it's not, because then your body thinks it needs to hold on to more fluid. So that's the thing with diuretics. That's why they can actually intensify your swelling. So if you're just like dying thinking about not drinking as much coffee, switch to decaf, switch to herbal tea, like peppermint, which can also give you an energy boost and soothe any nausea you might have. All right, and drinking more water is one of the best things you can do for your swelling, because as strange as it sounds, again, to drink more when you're trying to reduce the fluid intake. As I mentioned before, if your body thinks you're dehydrated, it will hold on to even more fluid to compensate. So try to drink at least 10 8-ounce glasses of water every day. This helps to keep your kidneys flushing out all of the bad stuff and helping to keep your body happily hydrated. Interestingly enough, increasing your protein can also help to reduce swelling. So you want to get about 100 grams of protein each day. You can take garlic and parsley oil pills if your care provider gives you the go-ahead. That's important. Usually they can actually come together in one gel capsule that can help to reduce edema. And edema is, if, for example, you have really swollen ankles and you press into that skin and it stays indented for a little while. Again, usually not dangerous, but just kind of a weird thing that can happen. So garlic and parsley oil pills, reducing your sugar intake is really important. And remember that sugar is in a lot more foods than just sweet foods. For example, rice, pasta, bread, grains, fruit, all have a lot of sugar in them. All right, elevating your feet and resting can do wonders for reducing that swelling, especially in the legs, the ankles, the feet. It helps to promote your circulation. Wearing loose, comfortable clothing is much preferable to like tight polyester duds during pregnancy. Let your body breathe. Get rid of those tight clothes when you're pregnant, especially if you're really swollen. Avoid elastic waistbands like the plague. Maternity maxi dresses, especially in the summer, are where it's at. Stay cool because, as I've mentioned probably multiple times now, that heat can exaggerate swelling. So cool off as much as you can. You can put a cool compress on your feet, on your neck. Always have that like fan nearby. You can wear, I know this doesn't sound comfortable, but it can actually help. And it's funny that I'm using this one after saying wear loose clothing, but wearing waist-high compression stockings can actually help. These are absolutely as sexy as they sound. But again, if your legs, if your ankles, your feet are just persistently swollen, these stockings just gently squeeze your feet and your legs to help to keep the fluid circulating. And there are knee-high compression stockings, but some care providers actually advise against these because they can be a little bit too tight in the middle of your leg and actually make the swelling worse. So that's why we say waist-high compression stockings. Walking, even just going on like a 5-10 minute walk, can help to improve your circulation, reduce swelling. Wearing comfortable shoes, you might notice that as your feet get more swollen, there might not be many pairs of shoes that you can actually fit into. So find the ones that are loose and comfortable. Do not try to shove your foot into a too tight shoe. That's just going to make everything worse. Swimming is one of the best exercises to do during pregnancy, especially if you're swollen, because it can help to cool you down. Again, really promotes that circulation. It takes a lot of weight off of you. So for example, if you're in the 3rd trimester and that baby, that heavy uterus is just putting so much pressure on your pelvis, causing more swelling in the legs, being in a body of water can feel so good. It can make you feel so much more weightless. Getting a massage from somebody that is trained to give prenatal massages, again, helping that circulation. Sleeping on your left side is really helpful because this can improve blood flow, which again reduces that swelling. And lying on your left side also takes the pressure off of your uterus, or takes the pressure off of your uterus, off your vena cava, which is the 2nd largest blood vessel and that helps to return blood to your heart. So never possibly want to keep pressure off of the vena cava. So again, sleep on your left side as much as possible. And again, the one thing I want to remind you yet again is that the swelling is temporary. It will go away. So do all you can to reduce it, but also just hang in there and know that there will come a day when, again, it doesn't feel like you've been injected with Play-Doh.